This is May 31st, 2013. I'm Dr. Kenneth Cherry with Dr. Jimmy Yao, and we're interviewing Dr. Enrico Ascher. Enrico, you grew up in Brazil and went to school in Brazil. Did you know from an early age you wished to be a surgeon?
Actually, no. I never thought about being surgery. I wanted to be an engineer. But somehow my mother, which was a very domineering mother, she wanted us to be doctors, all of us. She said, I always dreamed that my children will be doctors sometime. So she gave us the option. Either you go work early at age 14, or you become a doctor. So none of us want to work that early in age, and we decided, okay, we'll become doctors then. But of course, I really developed a liking once I visited my uncle, who was a gynecologist, and I felt that fascination about the world of medicine, and I was kind of attracted about it. And so I went to medical school and in Brazil, although I was not born in Brazil. I was born in Cairo.
I apologize.
No, it's okay. During medical school, I was very fond of psychiatry. So I rotated through psychiatry, and I did 1 month in psychiatry, volunteered the rotation, and I was kind of liking that idea of understanding more about the brain. But also, I was a preceptor in anatomy. And eventually, anatomy took over, and I loved it so much that I decided to become a surgeon through anatomy rather than
and you said your mother said you all have to become doctors.
Yes.
How many brothers and sisters?
We're all doctors.
How many are there?
4.
4? Do your brothers, is it brothers and sisters? Or
I choose 2 sisters. One is a cardiologist, the other one is an internist, and my brother is a pediatrician.
Do they practice here in the United States or in Brazil?
Not in Brazil. They're all in Brazil.
Where did you grow up in Brazil?
In Rio.
And how did you come to be born in Cairo?
Oh, I was born in Cairo. My father was in the oil business, and he was traveling, and I was born in Egypt. He was in charge of one of the oil companies. He didn't own it, but he was in charge. So I was born in Cairo, and we stayed there until I was 6 years old, and then we moved. When Nasser took over, they closed his company, and we had to move, and we went to France, then Italy, then Brazil.
Wow.
That's
fascinating. And then you pursued residency training in the United States?
Yes, I was very fascinated about the academic, I had fascination about academic surgery. I wanted to contribute to whatever specialty I was going to choose. And at that time in Brazil was very difficult, contrary to now. Now the environment is very favorable for research, and high-level research too. But at that time was very unfavorable, and the United States was the promised land for all those who wanted to produce and collaborate in projects. And so I was very fascinated about the idea of coming here. So I took the necessary testings, and I did a residency again here in general surgery. And then I spent 1 year with Frank Vieth as a fellow in vascular surgery at Einstein. And I loved it. Frank was, as you know, is a very motivating person. And he opened so many doors for me. It was just like, I had a great time at Montefiore.
Did you decide during your general surgery residency, at what point did you decide to become a vascular surgeon?
I decided to become a vascular surgeon because I want to be the ideal general surgeon. And that was missing. That portion of vascular at the time was missing from general surgery during my training. So I decided to do this extra year. But then again, working with Frank Vieth, I just fell in love with the specialty, and it was a very young specialty. It was easy to contribute to, and you get involved in research. I did some basic research, which I like too. So I just fell in love with the specialty.
Was Dr. Haimovici still active when you were at Einstein?
Yeah, Haimovici actually was very active. I did 2 operations with him. And he also was a very nice, not very nice, a very capable scholar, I would say. He's really a true scholar. And he motivated me about, at least he gave me some, not motivated me, he gave me some of the basic principles that's necessary to develop an academic career. So I had the best of the best. I had Frank Wiet and Hamovici telling a young vascular surgeon what to do and how to go about it. So I was ecstatic. It was the best years of my life.
So where did you start your career when you finished your training?
I started at Montefiore with Frank Wiet as a chair, and I stayed there for about 7 years, where I did some basic research, clinical research, and I was very busy. I just loved my vascular surgery. For me, it was spending 7 days in the hospital was not a chore, it was a pleasure. So I spent, and then I felt that after 7 years that was about time for me to start my own service. And with Frank Wiet's blessings and everybody else's blessings in the institution, I moved to Brooklyn and started a whole new service. As a matter of fact, I was the first board-certified vascular surgeon in Brooklyn. I would say if Brooklyn was a city, it would be the 4th largest city in the United States.
And there's a real renaissance going on in Brooklyn now, as you know.
Yeah.
They say the best restaurants in that area are in Brooklyn. Did you start that renaissance?
I wish I. But I was always very busy with the practice, very busy. It's hard to do everything unless you're 100% committed. So I didn't have much time to appreciate the restaurants around, but probably now I will.
What areas of vascular surgery are you most interested in? In your practice, what is it that you like to do and you feel that you are offering something to the profession?
That's a very good question. It has evolved over the years. Initially, I was more interested in basic science research, but I always had a fond for clinical research also. And this has actually become more the focus of my life. And I was initially, again, motivated by Frank Wiet's work in limb salvage. I felt that I could move, especially one step forward in limb salvage, in developing techniques to salvage limbs that were considered or deemed unsalvageable. And so I was able to develop some techniques based on the necessity and the challenge of trying to save the leg of this poor old lady who, if she would have an amputation, she would not be able to walk anymore. So we were able to develop some techniques like we modified certain fistulas. We did several techniques that were very helpful, transposition of small vessels. The field was open to be developed. So we were able to do many techniques for limb salvage in the beginning of my career. Then I was very interested in carotid surgery, and I thought carotid surgery could be changed a little bit, like discharging the patients much earlier, making a small tiny incision by using duplex scan to identify the location of the lesion so you don't have to make long incisions anymore. In a sense, I was trying to compete with carotid stenting. So I said I have to minimize that operation in such a way that people say, oh, what's the difference? The Band-Aid here and the Band-Aid there.
Yeah.
But so I've done some work on that in this area. And then I like the idea of being minimally invasive person. I think the least pain we offer, the least pain the procedure entails, the more there's more satisfaction, patient satisfaction, and we also feel much better if we're not inflicting pain on the patient. So smaller incisions, minimally invasive approaches such as no dye during a balloon angioplasty, no radiation because we're all exposed to radiation at all times. So I developed a technique where we can do balloon angioplasties and stentings without radiation at all and without a drop of contrast material. And this is ultrasound-guided balloon angioplasty and stenting. And we did that in the lower extremities. We used this approach in the lower extremities and in the even for carotid angioplasties.
Are you still using it in the lower extremities?
We're still using it.
And you were really one of the early proponents of that, and I think the most eloquent proponent for it.
Right. We're still using it, not in the majority of patients now, because to do these procedures, you need a helper that knows what's going on and knows ultrasound very well. And the person that was helping me, which developed this approach with me, her name is Dr. Marks, Natalie Marks. She was a Russian neurologist who immigrated to the United States, and for many years she raised her daughter, and she was working as a vascular technologist Then she became a physician. She just finished her residency now. So during that period, I had to diminish the number of cases that we did. But now we're going to go full force and again trying to push the envelope in this area.
Now, you set up this practice in Brooklyn, and recently you left and moved down the street. Has that been a success for you?
Well, in terms of the practice, has been even more successful. Actually, we increased our practice in 20% in the last 12 months in comparison to what we had before. It has been a boost in terms of excitement because a whole new approach, starting over. And it has been good. I think it's not a bad idea to move from one institution to the other after a few years. Actually, we spent 21 years at Maimonides.
How many children do you have?
I have 2 children.
And what do they do?
Oh, I'm very proud of both. Michael just finished his residency in psychiatry.
Oh,
So
so
some of
someone,
the gene was passed
Somebody
on.
really went get into psychiatry.
And where did he do that?
He's just finished now last week, and he
I mean, but what institution?
at Beth Israel in Manhattan, and he won the award of the best research resident. He has several publications already. He loves academics. He loves psychiatry.
Is he going to practice in New York, or does he?
He's
know-
doing a fellowship at UPenn in addiction, and after that he's going to practice in Philadelphia. He also wants to do research in psychiatry. He feels that psychiatry needs some more neuroscience research and things
Well,
like
you
that.
have every right to be proud. And your other child?
And my daughter is doing business. She finished at Columbia, and she's doing business in Washington. So they're doing very well, both. Very happy with them.
Congratulations. Do you get back to Brazil to visit much?
I do. I go back to Brazil at least twice a year to see my mother and my brothers, my sisters. I do go to Brazil because I organize a Pan American Congress every 2 years, which was the first, I think, effort to bring South Americans and North Americans together. And now they have blossomed. They have their own meetings, and they have several meetings. And I think the goal of the Pan American has been accomplished. Whether I'm going to continue with it or not, that I have to decide.
You were president of the Society for Clinical Vascular Surgery and the president of the Society for Vascular Surgery within a 2 or 3 year period, as I recall.
Yes.
Are those different organizations? And if they are, what makes them different?
I consider them sister organizations. Basically the same people, in both. I think that the Society for Clinical Vascular Surgery focus more on just clinical work, more so than in basic research. And I feel that it's almost like a training camp for becoming president of the SVS. I did not have much of a chance of participating in too many of the committees in the SVS, but I felt I was ready to take over the SVS based on what I learned from the Society for Clinical Vascular Surgery. So I think it was very helpful. It was very nice.
And a little change of topic. What are your hobbies? You get a little bit of spare time. You decide not to spend 7 days in the hospital having fun. What do you like to do?
I like to read. I like to play tennis, although lately I have not played because once I changed. I like boating. I like everything outdoor. I like the outdoor life. But unfortunately, I don't have much time to enjoy it. Yeah. And once we hire our next partner, we definitely...
How many partners do you have right now?
Right now, with the move, I only have Dr. Ingarani. And we're both working 7 days a week. So he's a great guy. He's very academically oriented. He's a great clinician. He's probably the best partner I could have imagined having.
And you have stayed very close to Dr. Veith, have you not?
Yes.
Yeah.
Veith has been my mentor. He's my friend. He's my critic, and he's like family.
Yeah.
He's great.
Jimmy?
Well, welcome to the interview.
Thank you.
We have been, this is number 58, I think, interview we have done.
Okay.
Looking back at all the interview we have not much information or talk about American Board of Vascular Surgery. I know you were somewhat involved, especially you're close to Frank, so you know more about American Board of Vascular Surgery. I think it's a very important part of the history of our society. So I would like you to say
Yes.
more about the American Board of Vascular Surgery.
Okay, Jimmy, I'll be happy to. You know, I think that the American Board of Vascular Surgery has contributed enormously to the progress of vascular surgery in this country just by its existence alone. Because the American Board of Surgery knew that there was an entity that was demanding better recognition of vascular surgery as an independent specialty. So by knowing that, we eventually achieve our primary certificate. I really don't feel that that's enough. I don't think that we have enough independence in terms of recognition as an independent specialty. And I think we should continue, again, in a way that we don't become divisive, we don't become enemies, but rather that a constant, slow push to achieve what we need to achieve, especially now. I think now our specialty has been in tremendous competition with other specialties. We are under a lot of pressure from cardiologists, cardiac surgeons, basically doing a lot of what we do, which is endovascular procedures. And the more we identify as independent specialty taking care of all aspects of vascular diseases, the better we'll be in the future. So I think that the time that I was involved heavily with this movement, led by the American Board of Vascular Surgery, was very profitable for vascular surgery. I think we accomplished a lot. We eventually made friends, and my presidential address to the SVS was, "We speak with one voice." And my main goal was to bring all factions under one umbrella and basically try to work together for the aggrandizement of vascular surgery. And I think I did that. But I don't feel that the job is complete. I think we still have a lot of factors out there, a lot of people trying to take our specialty. And I'm not paranoid. I mean, it happens every day. And we have to be cognizant that we can't just sit back and believe that we have control of vascular diseases, the management of vascular diseases forever. It's an evolving thing. We really have to keep working on it. We have to identify where our weaknesses are and develop some strategies to combat that. And I think it's the goal of the current leadership and future leadership of the SVS to work for that goal. I think the SVS has been one of probably the nicest, the best societies I've ever seen. They have the growth that we have noticed lately in the last few years is extraordinary, really extraordinary. There's nothing that we can define SVS accomplishment than saying it has been an extraordinary accomplishment. We are now a very mature society. We have a well-organized leadership, but we cannot forget that our specialty is constantly under assault, and we have to be cognizant of that.
What do you see as, we have so many training paradigms now. We have the classic 5+2, we have the 0+5, we have the 4+2, we have the infrequently used 3+3. What do you have any views as to what the ideal training for young vascular surgeons in the future will be in this country?
Well, I'm biased in that. It's a very good question for me because I'm kind of biased. I was the first one that actually suggested 0.5 during my presidential address to the Society of Clinical Vascular Surgery. I suggested the paradigm, and people in the audience really raised their hand and said, "Oh, that's too much now." Ascher really went overboard with that 0.5. Yes, 6 months after, we started the work. And Jack Cronenweth has a lot to do with this accomplishment. So I'm totally biased toward the 0 and 5. I think it's the best program. People start thinking about vascular surgery since medical school. And then they're just continuing into vascular surgery. And they won't miss anything because they will still get the general surgery program. And the requirements that they need are sufficient, I think. The ones that are being offered to them during those 0 to 5 are enough for what they have to do.
Do you think that there is a problem nationwide in the established vascular surgery groups teaching young vascular surgeons how to still do open operations? Is that an ongoing problem, or do you think that endovascular techniques will end up totally supplanting open techniques?
I think endovascular techniques are probably going to supplant open techniques, but currently they're not. And I'm concerned about that. I'm concerned about the lack of open surgery. I don't think the number is sufficient in some large centers, but I don't think it's sufficiently offered across the country. I am concerned, especially a complex aortic case where you have to do it. Currently, I think you're right. I assume that you agree with me that it's not, we don't have enough open surgery to train all this.
It's hard to teach people to sprint if we haven't taught them to run.
Exactly.
To throw someone into a super mesenteric aneurysm when they've not operated on infrarenal ones is a difficult proposition, and one that we hear a lot of talk about. And I'm just interested in, you've been involved in education, you've been involved in administration, what your thoughts on it were.
But I think that endovascular is moving very rapidly, and eventually it may at least cover 95% of the cases we do. But it's still going to remain some cases that needs to be open, and I'll be concerned about that. Probably we have to be referred to some centers. Not everybody will be able to do it.
Big chunks of calcium don't yield to balloons
No.
very well.
Right.
Jimmy?
In your presidential address, you mentioned about forming a chairman of vascular surgery organization, something like that. Did you propose about?
Oh, yes.
Yeah,
yes.
what happened to it? I haven't heard anything about it.
Well, it's still in existence, but
What you call it?
Association of Chairs in Vascular
That's
Surgery.
right. Yeah.
Yeah, I wanted all the chiefs of vascular surgery to get together under an umbrella that were not necessarily related to teaching or to fellowship programs, but rather to just current problems, whether they're financial or clinical or whether recruiting. And the first couple of years were very successful. The room was completely full. But you need someone that's interested in the subject to continue it.
Yeah.
I gave it to the SVS.
I see.
I asked the SVS to take over. At this point, there have been discussion on what to do with it and how to go about it. But it was covering so many of the aspects that is already being covered by other programs during the SVS. So it's kind of floating, and it's not really been identified as a major program. But I think you need somebody who will be interested in further developing it. But I think chiefs of vascular surgery should have a place where they can discuss their own issues as chiefs of vascular surgery. The relationship with the dean, relationship with the chairman, with the attendings, who to hire, who not to hire. There's a lot that can be done, actually, to make a service better if we all talk together under one umbrella, under one roof.
Another little bit of change of topic. With the Affordable Health Care Act or Obamacare, whatever we may wish to term it, do you see an onerous effect on the financial aspects for vascular surgeons in the future?
It's a tough question to answer, and it's not. I'm in a very comfortable position now, so I'll be biased just based on the fact that I'm financially comfortable, because we enjoy the golden years of vascular surgery. But for the younger people, for the younger surgeons, they know they're going to vascular surgery with changes that are going to occur financially. They're not going to make the kind of money that we were able to make in the last decade. That's not going to happen. So it's their choice, number one. Am I concerned? Yes, I'm concerned. Are we going to stop people from going to vascular surgery because of financial deals? The deal is different? I don't think so. I think people are still going to look for vascular surgery. Still people are going to apply for medicine. They're applying in record numbers. They're just not going to have the kind of life that we were able to have in terms of financial comfort. But people will survive. I'm not concerned about that. I think people will survive.
Do you think that the patient-doctor relationship will stay private, intimate, and good?
No, I don't think it's going to be the same. I think they're going to, and they're going to follow what they're told. Most patients will have to follow what they're told, unless they would have to pay much more for private care, and they can afford most patients cannot afford that. So they're going to follow what the government tells them to do. There's no question. And this relationship, I don't think is going to exist anymore. And that's a pity. And the problem is, what I'm concerned is that the hospital administrations in this country are taking advantage of the situation. They're trying to hire all the physicians in private practice around so they can control the patients. And there's always somebody controlling. And unfortunately, surgery is not at the head of the table. And once the administration gets all these medical doctors that have all these patients under their facility, then I think we're going to be in a little bit of trouble, because we're going to be working for the administration, not only for the government. One way out of this is developing ambulatory centers. And vascular surgery fits very well for ambulatory centers, where we can become independent from the administration. But then there's other strategies that we have to really discuss and work on it. But this is the thing I've said, that we really have to be recognized as an independent specialty, independent from cardiac surgery, independent from cardiology, and emphasize again is what I said in my presidential address to the Society for Clinical Vascular Surgery. We do vascular medicine, we do interventions, and we do surgery. And we're the only specialty that can do all those three. And I said that maybe 10 years ago. So I think, and it happened. We really do that in our practice on a daily basis.
So, a couple questions. Do you think we have too many surgical society? We are regional, clinical,
That's a good question.
SVS, and World Federation, International, endovascular. I mean, you name it. Don't you think we have too many?
You can look at it that way, that we have too many. But on the other hand, you can see that every society have gathered members that like a little bit what they do. Each society has a different flavor. Some are international, they travel everywhere, so people can take advantage of this to visit other countries and to interact with other surgeons. Here in the United States, we have the regional society that allows younger surgeons to present papers and to apply the manuscript to the JVS. I think each one has found its niche. And those who don't have enough members won't survive. I'm not that concerned about the number of societies. I'm more concerned about that we should get together and identify the problems that are going to affect our specialty in the next 10 years. And there's another thing that I had the opportunity to do in the SVS, is to develop an advisory board among all societies, regionals and others, so we can talk. And that's working very well. So we can interact in a direct basis among all the other societies under the leadership of the advisory board.
My last question is, what are you proudest of in your career?
What's what, I'm sorry?
What are you proudest of in your career?
That's the toughest one.
Of course.
The proudest of my career, I think, was coming to this country.
Okay.
I think that was the best decision I made in my life. Here I found, I would say, happiness. I found accomplishments. I developed great friends. I found the SVS, which I think is the best society in the world. And I'm a happy man. So that's what I'm proudest of, is find happiness. And I think I'm a happy man. And I will always cherish the fact that I was elected to a presidency of the best and largest vascular society in the world. I don't deserve it, but I didn't say no.
Thank you.
Thank you very much for the opportunity.
We all have failures. How you handle your failure? Do you have any, or you don't have any?
Failures? Many.
Failures.
Many, but you told me there's no much time, so I cannot elaborate on those.
What would you tell young guy should do when they start their vascular career? What kind of advice you would give them?
That's a very good question. What I will give them, advice I'll give them is, number one, be honest. Be honest with yourself. Find what you like to do. Pursue it. Don't let obstacles stop you, because we all see obstacles every day of our lives. But think of what you would like to do, not just now in the next 2 years, but for the next 40 years of your life. That's my best advice. And then once you decide that, I can guarantee you, you're going to accomplish everything you want. Because if I could do it, you can do it.
Well, thank you for coming to the interview.
Thank you very much. It was really a pleasure.